Agents, hey, this is Luis Moreno with Insurance Agent Training. What options are there for a Medicare client who has a condition and you want to get them a hospital indemnity plan? And they are not 65. So this client is under 65, has Medicare, has a Medicare Advantage plan, but has Parkinson's. And we want to give them an indemnity plan that will help them with some of the costs they're going to incur on their Medicare Advantage. So I've got a solution for you guys. It took me a while to figure it out, but I do have a solution for you. But before I share that solution, do me a favor, please comment down below. Okay. Please like this video, give me that thumbs up. And if you would, make sure you subscribe to the channel. I really would appreciate the support. All right. So my go-to hospital indemnity plan is Heartland National. Okay. So I use them regularly, guys. And if you don't have Heartland National in your portfolio and you're a Medicare agent, you need to add it. Send me an email, luis@insuranceagenttraining.com, and I will send you a correction. Luis@insuranceagenttraining.net, and I will send you a contract for Heartland National. I love using Heartland National. Here's the deal. Okay, so I went and ran this quote here. So let me share this with you guys. Get my screen going, and I will share what I found. Okay, so what you're looking at here, in fact, let's go to this section right here. So what you're seeing here is I actually ran a quote for this person. And it's a pretty good quote. I like using Heartland National for my indemnity plans when I'm doing a Medicare Advantage plan. And normally this is what I do. So I'm going to share with you exactly what I do. So I go in here, we'll put the insured's name. We'll go in here and put their date of birth. And my base plan when I go to Heartland National is I will choose the daily benefit. So you're going to go to your summary benefits, go pick the daily benefit. For the plans that I offered this person, it's $150 a day for 6 days. Okay. Person lives in Texas and they are married. Okay. So boom. What you're seeing now is the quote as soon as it pops up here. Now, the base is this, guys. I do 3 things on the base. Number 1 is we cover the hospital confinement daily copay. Secondly, we're going to match how many days. The ER is a built-in included benefit of $150 reimbursement. And then I add a $200 ambulance. Now the ambulance in this Medicare Advantage is $275, but we're only going to reimburse up to $200. This is a $14 a month benefit. Now, typically what I do is I go a step further and I go add cancer. Okay, chemo is 20%. So they're going to hit that 20% of the max out of, or they're going to, with the 20%, they're going to hit that maximum out of pocket. And typically they're going to hit it for 2 years. So in the plan that I offered, I had a $4,200 max out of pocket. I double it to $8,000. I just go to a straight $10,000. Okay, this is my go-to. Okay, I'm at $41. Now while I'm doing this, I kind of play with some numbers here with this insured. Can they afford the $41 rate? If they don't, I start adjusting this amount. Okay, that's normal. Okay, but the scenario here is this person is 63 years old and has Parkinson's. Now, with Heartland National, if they're 65, 6 months before, 6 months after, it's a guaranteed issue for the medical. Okay, so let's just say we're going to take this and I'm going to do the apply now. Okay, so again, if they're 65 years old and 6 months before, 6 months after, okay, so here it is. If you're within 6 months before or after of your 61st birthday, what's going to happen is all of these questions are going to be grayed out, which means you can't answer them. Okay, you will always have to answer these 2 questions right here. Okay, in the past 5 years, look back for internal cancer, lymphoma, sarcoma, and the rest of these conditions. Okay, and then you will have to answer this no matter what. Okay, and why is it not marking it? It should mark it. Okay, get out of there. Yep, I don't know why it's not marking. There we go. Well, who knows? Okay, anyway, regardless. So they got to answer this and they got to answer this. If they answer yes to this, then they cannot get the cancer benefit. Okay. But remember, my insured is 63 years old and has Parkinson's. So they're going to have to answer the questions. Well, look at one of the questions here. Parkinson's is right here. So by them answering yes to this question, they're going to be denied. So I can't offer them a Heartland Indemnity plan. So I went to UH1. This is the ancillary branch. Well, this is the branch of United Healthcare with all these ancillary products. You get short-term medical. You get hospital indemnity for people under 65. We're going to use this Advantage Guard hospital indemnity for people 60 through 90. Okay, so this is more of the Medicare type of product. So I went in here and look at what I found. So I went in here and I'm quoting this benefit. Oh, let me share this tab. I'm sorry, I wasn't sharing the correct tab. Okay, again, I went to United Health, UH1, which is the individual branch of United Healthcare. Now, you agents will not have access to this unless you have a contract for UH1. So you may have UH Medicare, great. You may have UHC for ACA, great. This right here is a completely separate contract. If you don't have it, email me, insuranceagenttraining.net, and I'll send you a contract for this. But we get in here and let's go look at the benefit options. So I'm going to scroll down through here. And so here are the beauty of this plan. This is guaranteed issue for anybody between 60 and 74 years of age. You can offer this product to anybody ages 60 through 90. So pretty darn cool. Now, I went in here. Remember, my benefit period was $150, or my hospital copay was $150 for 6 days. So I can go in here and edit this. I'm going to choose 6 days, $150. Now, as long as you stay within these numbers right here, okay, as long as you stay here, you'll see that whatever benefit amounts you choose here, these are guaranteed issue. If you choose these higher amounts, you're going to go into the simplified issue. You're going to have a little bit of underwriting here. But I'm sticking with $150, 6 days. Guaranteed issue. Okay? So I'm quoting that. Then I'm going to go down here and I'm going to add the extras. Okay, so I'm going to add the ambulance rider. So in the plan that I have, the ambulance is $275. I'm going to choose $300. Okay? As long as I stay here, it's guaranteed issue. If I go up to these higher amounts, I got to answer some questions. Okay, I'm going to add the emergency room. Okay, so the emergency room is $150. Okay, that's the copay for the emergency room on my MATB PD plan. I'm going to choose $200 here. That way they actually get a little extra. Okay, so as long as I stay within these numbers here, I'm in the guaranteed issue phase. Okay, so I'm doing that. Okay, so I'm going to add that one. I can go on here and add outpatient, an outpatient benefit, an outpatient drug benefit, skilled nursing. Now let's do cancer. Let's check this out. So I go to cancer, and as long as I stick with either 2,000 or 5,000, I can issue this policy. Well, I'm going to stick at 5,000. I'm going to go completely guaranteed issue on this plan. All right. Now check this out. With this Advantage Guard hospital indemnity, every benefit that I chose is guaranteed issue. This person has Parkinson's. I can get them this hospital indemnity that will pair up perfectly with their MAPD. All right. So pretty cool here. So remember, I matched it up. 6 days, $150. So I got their hospital pay code taken care of. I added the ambulance. I added the emergency room, and I added cancer, and I'm at $27 a month. Guys, this is not bad. And you can go on here and add all these different riders if you want to, and you're rocking and rolling. What a heck of a product. So if you guys do not have access to UH1 and you'd like to get access to it, okay, they have a whole suite of products. Not only do they have, let's see here, let me go back to all of their products. 1 minute here, pulling this up, but I will show you their whole suite of products that they've got. So they've got short-term medical plans for people under 65. You can do this. They've got this enhanced protector guard. This is an indemnity plan. Okay, they have these enhanced guards. This is the one that I was using for the for my Medicare client. They have dental plans. They have a dental discount plan. They have a vision plan. They have these accident plans. Okay, telehealth. So they have all of these ancillaries that you can offer your clients. So if you're wanting to get access to these ancillaries from United Healthcare, do me a favor, guys. Send me that email. I'll send you over contracting. I also need to know what state you're in. Okay, it's important. But when you're running into issues where due to underwriting, you can't issue a hospital indemnity plan, guys, this is a good way to go. This is Luis Moreno with Insurance Agent Training. Don't forget a couple of things, guys. Down below, okay, if you click on the more, I've got some stuff down there. I've got my email where you can hit me up, okay? Ask me for the contracting and I'll send it to you. But I've also got some good products for you guys. So I've got the ACA Smart Book for Insurance Agents. This is an insurance manual. It's got everything you need to know here. Okay, I have one for Medicare. Okay, I also have Agent CRM, which is the go-to CRM for insurance agents. Not only will you get everything that they offer, but you will get all of the workflows that I've created for ACA, Medicare, Life, ancillaries, as well as C. So you get the most of both, the best of both worlds for the same price. You will also get access to all the support that Agent CRM. It is a go-to CRM that you must have if you're an insurance agent. Also down below, guys, I have my course that I offer, that I partner up with Shauna from Social Waves Media. What she does, guys, I don't know enough on how to social media advertisement. This is all that she does. She has a course that she put together for insurance agents to help insureds sell or advertise on Facebook and Instagram. So if you want to learn how to get leads on social media rather than buying them, go get her course down below. Click on that course and you can see all the details. Get it from her. She will teach you how to advertise on those two social media platforms. All right, guys, don't forget to comment down below. I'm the only one that responds. Give me that thumbs up. And if you would, make sure you subscribe to my channel. If you're already a subscriber, guys, I truly do appreciate it. Have a good one.